My name's Ian Forster and I'm the Managing Director of Dentala and DO Implants. At Dentala, we supply dental implant products to the dental implant market for dentists. The dental implant market in the UK is changing rapidly. Dental implants still are in many places a very expensive commodity. It can be £3,000 one would pay for a dental implant. However, that's the reason that I got involved. It's a price factor. We want people to have the implants that they deserve, and not everybody can afford them at that kind of level. So we want dentists to have a better income, a better service that they can then provide to their customers and their patients, but without jeopardising the ability of their patients to have the treatment in the first place, which means us finding the best products at the best prices for them to use. DO implants are those products. DO implants, they are some of the best products in the world. We are the exclusive distributor for the UK market. People like our products because the quality of the manufacture, the usability of the systems, and the service that we provide to them. Having the privilege to see so many dentists doing so many different types of surgery, we've been able to look at the products which they use and the techniques they use. Traditionally, for restoration of a bone where there's a defect, so if somebody's lost teeth and that bone has been resorbed over time, the bone will no longer be there and it needs to be restored. Some people will say they need a sinus graft for that, you need a really small implant. Basically, it's avoiding the issue. And in many cases, the bone can be restored. The gold standard, which is still taught in many of the universities in the UK even today, is to remove bone from someone's chin or iliac crest and to screw that into the place, which should provide somewhere for the bone to then knit to, if you like, and an implant to be placed into. However, when that bone is removed, it's dead. If you drill a piece of bone out and you make it back into a putty-like thing and you put it back into the bone, it still needs to be resorbed before any new bone is grown. A large piece of bone, whether it's from the patient itself or from people who use cow or pig and things like that, always needs to be resorbed back into the body before new bone is formed. These techniques I don't believe to be the most efficient, I don't believe them to be the most ethical, and we've now discovered that through the use of synthetic materials we can have host bone, so the patient's own bone can be grown within, say, 10 weeks. We also provide dental implant training, so a surgeon or a dentist wanting to become a surgeon or a surgeon wanting to further their knowledge of implant surgery can come to us and we will be able to teach them the best protocols and the best use of products available in the market. The format of the dental implant training is it's a 6-month program which takes up about 2 days a month of a surgeon's time, and that's going to be based in Portugal. The dental implant motor that we provide is by BNR, which is one of the best companies in Europe. It's made in Switzerland. The good things about the motor are the quality is fantastic, Swiss made, we know that. There are lots of implant motors out there that's made in Switzerland, Germany, throughout Europe. What makes this very different and, in my opinion, much better is the usability based on an iPad. Well, the great thing about the iPad is everybody knows how to use an iPad. So you'd go into the system, you'd select your implant, and then you'd select the site in which you place it. Following that, you'd select your bone type. The iPad would then work out the specific drilling protocol for that implant system, whether it's DO implants or any other implant system, that's relevant to that bone type. It would then record every single stage in a patient record that can be delivered back to the practice and kept for your own records. At Dentala, we like to push the boundaries of what's possible in dental implant training. We're using 3D immersion technology to allow people to experience surgery from the surgeon's perspective. The surgeon would put on the headset and they'll be able to see firsthand what it's like to go through the surgical protocols of the person placing the implant. We can use these technologies to allow somebody with only an iPad to experience dental implant surgery from the comfort of their own home, from the perspective of a surgeon sat right across the world. These are the products that we like to supply to the industry, and we like to change the industry, or at least influence the industry and give them the option to using these products and also teach them in the use of these products so that the patients benefit, the dentists benefit, and we have a happier market.